Welcome back to MLT 130. This is part 3 of the liver lecture. In this portion of the lecture, we're going to be covering the different types of hepatitis. In general, the term hepatitis means inflammation of the liver, and hepatitis can be caused by a virus, a bacteria, parasites, radiation, drugs, chemicals, autoimmune diseases, or toxins. There's various viruses that target the liver. Of course, there are different types of hepatitis, A, B, C, D, and E, and we're going to talk about those more in detail here in just a minute. But there's also CMV, cytomegalovirus, and cytomegalovirus, or CMV, has a wide range of symptoms, and this particular virus is caused by the herpes virus, and symptoms include sore throat, fatigue, fever, and muscle aches. There's also the Epstein-Barr virus. This is also known as mono or the kissing disease. And then there's HSV or the herpes simplex virus. Let's first talk about hepatitis A or Hep A. The common abbreviation is HAV. You can get Hep A from contaminated food and water, and it's usually contaminated with feces, so it enters the oral-fecal route for transmission. It's identified by finding the IgM, anti-HAV antibodies in serum during the acute stage. The IgM antibodies disappear after about 8 weeks. As a result of hepatitis A, you can have IgG antibodies for life, or they may show up for years, or just during the time of convalescence. Convalescence is the time spent recovering from sickness or illness. There is a 2-step vaccine for Hep A, and it's recommended if you travel abroad to get that vaccine. Now let's discuss Hep B, also known as HBV. It was previously called serum hepatitis. It's common throughout the world, and it can be chronic. Hep B is a DNA virus. The DNA is contained within a Dane particle. If you look over here on the right-hand side of the slide, you see an example of what the Hep B virus looks like, and this is the Dane particle. You have core proteins, and you also have surface proteins. Hep B is part of the hepatinovirus family. The outer is a Hep B surface antigen known as HBsAg. The inner protein is a Hep B core antigen known as HBcAg. Of course, we know that Hep B is a bloodborne pathogen. There's a few different ways we can come in contact with Hep B. The first one being parenteral, which is coming in contact with mucous membranes or skin. If there's contaminated blood or blood products that comes in contact with your skin or mucous membranes, you could become infected. Also, there's sexual transmission of Hep B. And then there's perinatal, where the infected mother with Hep B can pass it to the baby. Hepatitis B has a long incubation period of 1 to 6 months. When testing for Hep B, we can look for different components of the virus. We can look for the Hep B surface antigen, and it's going to be present in both acute and chronic infections. Then we can also look for antibodies. We can look for antibodies to the core antigen, and then we can look for antibodies to the surface antigen. The antibodies to the core antigen is the most commonly detected antibody in a person with or who has had the hepatitis B virus. But if you're looking for the antibody to the hepatitis B surface antigen, this is the only marker found in people who have received the vaccine. Okay? But in patients who have had hepatitis B virus, liver enzymes AST and ALT will be markedly increased. So when testing a patient with Hep B, the Hep B surface antigen is going to be the first serological marker to appear in serum. And that's going to happen within 1 to 2 months after infection, before any evidence or symptoms of hepatitis occur. Then the B Hep B core antibody is the first antibody to appear, usually coinciding with onset clinical symptoms, and that usually happens around 3 to 6 months after infection, and this is diagnostic of a Hep B infection. And this is the most commonly detected antibody, which we said on the previous slide. And then finally, then you're going to see the B surface antibody, and it's seen during recovery. So the only way that you end up with a Hep B surface antibody is if your body's in like a recovery or if you have received the vaccine in the past. Now let's move on to Hep C. It was formerly known as non-A, non-B hepatitis, but now we call it HCV. It was discovered in 1989. It is considered a bloodborne pathogen because you can get it from blood or body fluid transmission. It is an RNA virus. It's part of the Flaviviridae family. There's currently no vaccine. It's the major cause of chronic hepatitis. The tests that we can run for Hep C are a PCR test or an anti-HCV test on serum, and that's the most common screening test that's used for Hep C. Next is hepatitis D, or the Delta virus, hence D, Hep D, Delta. The abbreviation is HDV. It lacks a protein coat and cannot reproduce unless hepatitis B virus is present. The tests we use are antibody test in serum to detect the hepatitis D virus. Next is Hep E. Hep E is rare in the U.S. It enters the body through the fecal oral route for transmission. It is an RNA virus, and that's pretty much all we're going to learn about Hep E. For our laboratory testing for viral hepatitis, our serum markers are used to diagnose for acute IgMs versus our chronic IgGs. Our liver enzymes usually show elevations before we see any peaks occur in bilirubin levels. And when we do see marked elevations in those enzyme levels, like our AST and ALT, they're usually anywhere from 8 to 50 times the upper limits of normal for our viral hepatitis patients. So here's our last trivia question for this lecture, and this is going to go back and cover all the information we've covered in part 1, part 2, and part 3. The patient presents with the following results. You have a total bilirubin of 3, a conjugated bilirubin of 1.2, a quantitative urine urobilinogen that is absent, and you have a patient whose stool color is clay color. What is most likely the cause of these results? And it gives you the options of viral hepatitis, chemical damage to the liver, obstructive jaundice, or hemolytic anemia. So which do you think these lab results go with? Pause the video, try to figure out on your own before you go on and get the correct answer. The correct answer is C, obstructive jaundice. You have an increase in your total bilirubin, you have an increase in conjugated bilirubin, but the dead giveaway is the stool is clay colored, so you have obstructive jaundice. This concludes part 3 of the liver lecture. There are 2 more slides of study questions you can answer on your own and use as a study guide to prepare for the exam. If you have any questions about any of the information that we've covered so far in the liver lectures, please don't hesitate to reach out. I'm available during my office times, through email, or before or after lab time.